So very good evening to everyone. On behalf of Organized Nutrition, I welcome you all. So today there will be a very interesting webinar on thyroid disease, or few days before you know about the World Thyroid Day. So prevalence of thyroid disease, or especially hypothyroidism, has increased many folds. And always the persons, even the healthcare professionals, have many doubts or myths regarding the thyroid disease. So from our speaker, it will be get clear about the relation of the iodine, or what are the foods, goiterogenic foods you have to restrict or not. What is the relation of selenium, other nutrient or antioxidant? Is thyroid disease like inflammatory disease or not? What are the healthy fats? What are the healthy proteins you can add? Somebody totally avoid dairy product. Is it so? We have to totally avoid dairy product. Gluten. In the Hashimoto thyroid, somebody experienced gluten insensitivity or gluten sensitivity. So do you need to avoid gluten? Do you need to avoid soya product? Do you need to avoid cruciferous in a large? Which foods are sensitive? So from the patho to the diet, it is a journey. So without any delay, I like to invite our course coordinator, Paramita Patnayo, to I hand over the session to Paramita. So Paramita, you can just introduce the speakers and start the webinar.
Am I audible, sir?
Yeah, you are audible to speaker.
Thank you, sir, for giving me the opportunity. Very good evening and warm welcome and one and all those who have joined for today's session. So today we will discuss World Thyroid Day is observed annually on 25th May to raise awareness about thyroid disorder and the importance of early detection and treatment. Our first speaker is Ms. Shubhangi Lal. She has completed her BSc in Food and Nutrition from Calcutta University, MSc in Nutrition from South. She has also completed her internship from Woodland Multispecialty Hospital. Previously worked in Sun Pharma as nutrition advisor. Now she is working practicing dietitian and freelancer. She is also our MNT batch 8 student. Second speaker is Oishi Shahana. She has completed her BSc from Calcutta University, MSc from WVSU, internship from North City Hospital. She is certified diabetic educator, currently attached with Abbott Nutrition. Our third speaker is Ms. Bidisha Das. She has completed her BSc in Food and Nutrition from Calcutta University, MSc in Dietetics and Community Nutrition Management from Vidyasagar University. She has completed her internship from Narayana Multispecialty Hospital, and she is a certified diabetic educator. Currently working in Nestle as a nutritional advisor. Our fourth speaker is Bidisha Acharjee. She has completed her MSc in Dietetics and Food Service Management, internship from KPC Medical College and Hospital, now senior dietitian and Shuddhi Hims Ayurveda Panchakarma Integrate Hospital. So without wasting much time, I hand it over to you, Ms. Subhangi Lal. Thank you. Over to you.
Thank you so much, ma'am, for the great introduction. So I'm a student of MNT Batch 8. So we are here to discuss this presentation on World Thyroid Day for awareness of thyroid health. Why it is important more? Because so that we can take care of our thyroid gland more. World Thyroid Day is annually observed on 25th of May every year, and it is initiated by Thyroid Federation International in 2008. Its primary objective was for the global awareness of thyroid disease and its profound impact on human health. This day serves as a crucial platform for educational initiatives advocating for better prevention, diagnosis, and management of thyroid condition. The thyroid gland, as you can see in the picture given, is a small butterfly-shaped organ located at the base of neck. Is a cornerstone of the endocrine system. It produces essential hormones which balances our metabolism. So those hormones are thyroxine, also known as T4, triiodothyronine, also known as T3, which are vital regulators of metabolism, growth, and development. The pituitary glands regulate thyroid hormone production through the release of thyroid stimulating hormone, also known as TSH, maintaining a delicate balance crucial for overall physiological well-being. Next slide, please. Now comes different types of thyroid disorders. First come the hypothyroidism. Hypothyroidism is a condition where the thyroid hormones are not produced properly and TSH are elevated. There can be number of causes. It can be autoimmunity, it can be hypothyroidism treatment, it can be radiation therapy, it can be thyroid surgery or thyroidectomy. Certain medications also impact to hypothyroidism. Now there are different factors working on this. As already mentioned, autoimmunity, it can be over response to hypothyroidism, thyroid surgery, radiation therapy, congenital hypothyroidism, pituitary disorder. It can be iodine deficiency. Pregnancy can also lead to hypothyroidism. Infiltration disorder, hypothalamic disease, postpartum thyroidism, and subcutaneous thyroidism. Now, next is the hypothyroidism. Hypothyroidism is characterized by more production of thyroid hormones and a low production of TSH levels. The major causes are injury to thyroid gland, serves knobs, socks. Some medications can also affect infectious diseases, hereditary damage to the pituitary gland, hormonal changes such as miscarriage, pregnancy, or irregular sex life. Inflammation of thyroid gland can also cause hyperthyroidism. Next slide, please. Now comes the signs and symptoms. So there are different signs and symptoms seen in different types of thyroidism. Now, in first hypothyroidism, we will go through. There are fatigue, lethargy, unexplained weight gain. If a person is not having with his full appetite, then also the weight gain is seen. It can be cold intolerance, dry skin, hair loss, constipation, depression, impaired memory, muscle aches, stiffness, slower heart rate, and heavy menstrual period. In hypothyroidism, we can say the opposite symptoms such as unexplained weight loss. It can be rapid or irregular heartbeat, also known as palpitation, increased appetite, nervousness, anxiety, irritability, heat intolerance, and increased sweating. Tremor in hands and fingers is also seen. Frequent bowel movement, difficulty in sleep, muscle weakness, bulging eye. It is also seen in hyperthyroidism. So here is a picture where you can see the child is suffering from hyperthyroidism and having all these symptoms. Next slide, please. Now comes the subclinical thyroidism. How can we identify subclinical thyroidism? We will see in this slide. Subclinical thyroidism is a mild form of thyroid. Patients having elevated TSH level, but the other hormones of thyroid, that is T3 and T4, are in normal ranges. So early identification is very crucial for subclinical thyroidism as it can prevent progression to overt thyroid disease. Diagnosis, as I already mentioned, that the blood test is required TSH, free thyroid hormones, T3, T4. From there, we can detect the subclinical thyroidism. So recognize the risk factors and screening high risk groups improves early detection rates. Now I would like to welcome my co-speaker, OEC Sahana, from this slide. She will guide you further.
Thank you, Shubhangi. We will see the early diagnosis, why early diagnosis is important for thyroid patient. Okay, so thyroid
Sorry. Okay. Thyroid is a vital organ in our body, and it plays a huge role in metabolism. Like, if thyroid is not producing properly, or not producing enough thyroid hormone, then hypothyroidism can occur. And in hypothyroidism patient, we see weight gain, cold intolerance, constipation, depression like symptoms. Even if thyroid is producing excessively, then that is called hyperthyroidism. In hyperthyroidism patient, we see weight loss, uh, heat intolerance, anxiety like symptoms. So, other than hypo and hyperthyroidism, thyroid also has a huge role on pregnancy. If thyroid is malfunctioning during pregnancy, it can lead to miscarriage. A low birth weight baby can be born. It also controls our mood. Even if we can early detect thyroid disorder, then we can prevent depression and anxiety like disorder. Okay. So, thyroid has a huge role in our overall system, and how we can detect this thyroid disorder, how we can clinically diagnose this problem. So, next slide, please. We can detect a person is having hypothyroidism or hyperthyroidism by this simple 3 lab markers like TSH, thyroid stimulating hormone, free T4, thyroxine, and free T3, iodine, thyronine. Okay. If TSH is high and T3 and T4 is low, then it indicates hypothyroidism. Or if TSH is low and T3 and T4 is high, that indicates hyperthyroidism. So, other than hypo and hyperthyroidism, in some people, it also has been seen that some autoimmunity is occurred due to thyroid disorder. So, what are those autoimmune disorders? We will see. Okay. So, next slide. Those autoimmune disorders are Hashimoto thyroiditis and Graves' disease. Next slide. Okay. What is Hashimoto disease? Hashimoto disease is an autoimmune disorder where the immune system attacks the thyroid gland, leading to chronic inflammation and gradual thyroid failure. So, what happens in our body? Iodine and tyrosine binds with each other, and through coupling reaction, and after that, DIT and TIT is formed, and DIT and MIT bind with each other, and T3 and T4 is produced in our body. So, this coupling process is catalyzed by TPO, thyroid peroxidase protein. Okay. So, in Hashimoto disease, it has been seen that antibody of this TPO is present, and that's why TPO is unable to do its function. That's why T3 and T4 production got interrupted, and that's why Hashimoto diseases occurred in patient. What are the symptoms? Fatigue, weight gain, cold intolerance, constipation. These symptoms we can see in a Hashimoto disease patient. How can we diagnose this problem? A simple blood test which shows elevated TSH with low thyroid hormones. This is the primary test, okay. But the confirmatory test is TPO-AB, okay. This is the confirmatory test of Hashimoto disease. If a person is having Hashimoto disease, what type of treatments a person can go through? The main treatment of Hashimoto disease is thyroid hormone replacement therapy. A person can go through. Next slide. Another autoimmune disease that occur due to malfunctioning of thyroid hormone is Graves' disease. What is Graves' disease? Graves' disease is an autoimmune disorder where immune system attacks the thyroid, causing it to produce excessive amount of thyroid hormones. What happens in our body? TRH stimulates TSH. TSH binds with thyroid receptor, and then all the T3, T4 reaction in thyroid gland starts. But in Graves' disease, it has been seen an antibody that exactly mimics like TSH that binds with thyroid receptor. But after this attachment, also unfortunately T3, T4 production starts. So this occur in Graves' disease, but in normal patient, what happens when T3, T4 production excessively occur, then a negative feedback mechanism starts that controls the excessive production of T3, T4 mechanism, T3, T4 production. But in Graves' disease, what happens? Since TSH is not bind with thyroid receptor, the negative mechanism, the negative feedback mechanism does not work. So that's why huge amount of T3, T4 production occur in this type of patient. The symptoms of Graves' disease are like weight loss, rapid heartbeat, anxiety, tremors, heat intolerance, etc. Diagnosis: uh, a simple blood test that shows low TSH and high T3 and T4 levels are the primary test of Graves' disease. And other than this, TSI, which is the confirmatory test of Graves' disease, can be done to can be done for a Graves' disease patient to detect a person is having Graves' disease or not. What type of treatment a person can go through? A person who is having Graves' disease can go through anti-thyroid medication, radioactive iodine therapy, and also some surgery also. Okay, so that's all. I will invite Bidisha Dash to continue the rest of the presentation. Thank you.
Thank you all to join. Thank you, sir, for this opportunity. Okay, as we already know about what is thyroid, the function, the types of, and their mechanism and all. So now we will talk about the part that thyroid activity in pregnancy. For this year, the theme is to prevention and also the awareness. So awareness and prevention is the motto for this theme of 2025's Thyroid Day. So now we will talk about that thyroid, how thyroid activity in pregnancy. Many times we can see that normally we don't have hypothyroidism in our like, but after the first trimester, we will see that the mother has suffered from hyperthyroidism. Even why this happened? Okay, there is a reason. The first reason is that uh, like during pregnancy, the protein synthesis is increases. That's why the TBG will be also increases. And when the TBG is increases, that's what happened? That the free T4 will decrease. So for this reason, in particularly for the in the first trimester, we see that many mother has suffered from the hypothyroidism. But everyone is not suffered from the hypothyroidism. Then who are they? Okay, for that reason, when we are not pregnant or before pregnant, we can detect it. How can we detect it? This is known as the subclinical thyroidism. So what is subclinical thyroidism? Before pregnancy, if we do the blood test and we see that our TSS level is high, but our T4 and T3 level is normal, this position is known as subclinical thyroidism, and this condition can lead to hyperthyroidism in the first trimester. Like what is matlab, if in first trimester, if the hypothyroidism is occurred, what does happen? It happens actually thyroid hormone helps to brain development, even in the myelin sheath development, growth of neurons. So if this condition is not treated, then the mother will faces like miscarriages, anemia, eclampsia, and the for the baby, she will delay her his cognitive delay, disturbs his cognitive. That's why it is very important to do the test and know is we in the subclinical portion, or we are in the same, or we are in already we are hypo or hyperthyroidism patient. Okay, next slide. Okay, hyperthyroidism in the womb. Okay, not only hyperthyroidism can be occurred, but it can be a little dangerous than the hypo. Why? As we already know that hyperthyroidism is also known as Graves' disease. So for Graves' disease, the TSH receptor antibody can cross the placenta. And when it crosses the placenta, it binds in the fetus body. So before birth, we can see that the symptoms of the Graves' disease may occur in the fetus, or that's why low birth weight or the muscle weakness or muscle breakdown or the low metabolism will be occur. So we need to test the blood test. We need to take the medicine in proper way. So for next slide. Okay. Now the role of estrogen in hypothyroidism. How estrogen is related to hypothyroidism or thyroid gland. Okay. There is a relation between estrogen and the thyroid hormone. How? Estrogen, if in our body the estrogen level is high, estrogen dominate or tells the liver to produce more TBG. Acha. So, अगर TBG is high, then same things occur. The free T3 and T4 will not be there. Okay, and we all know that the T3 and the T4 is the active form. So, to find it, we have to see the result of the estrogen. So before going to any medication or any, how can we know that our in our body the estrogen level is high or not? So we have to do the estrogen test or the hormone test, that is the TBG or the whole thyroid test that is concluded in TSS, T3 and T4. Many people we do na only TSS. We don't have hypo and hyper. I'm just doing that test. No, if you are doing that, then do the three profile totally. Then we can also detect that is she or he can suffer from the subclinical or not. Okay. Next portion. Okay. Phytoestrogens. Okay. Okay. Phytoestrogens are plant-derived compound that is found in soy or flaxseed that can mimic the function of estrogen. So in our body, there is not excess estrogen, but for some reason we are taking it as a food item from outside. So if it is we are taking in a large amount, so it can be causes a problem. So phytoestrogen can only mimic as the estrogen function, and also it also raise the problem in hormone production also. Okay, so they are showing some goitrogenic agent properties also. So we have to if we are detecting that we our estrogen level is high or we are going through the hypo or hyper, then we have to moderate the consumption of the phytoestrogens in our diet. Okay, next slide. Okay, now we are talking about the common thyroid diet and all diet related, concept or the disease related. Okay, many of us we go to clinic or we do the practice also. Can anyone tell some things like some debunk that they heard or they faced? So before I, explain it, I wanted to also hear from you. Can anyone, if there is any debunk they hear and all? Am I audible?
Yes, Nirisha, you are audible.
Okay. Can anyone say? Like
Unmute
অনেক
anyone
কিছু
and
শুনি আমরা কিন্তু আমরা অনেক কিছু শুনি থাইরয়েড সম্পর্কে, এদিক ওদিকের কথা। আর ডায়েট রিলেটেড তো অবশ্যই, ডায়েট নিয়ে তো আমরা সবাই বলে দিতে পারি। তো এনিওয়ান?
কেউ একজন আনমিউট করে বলো। Vidisha,
Okay,
no one.
then I will.
হ্যাঁ,
Okay,
yes.
okay. Okay, I will continue. Okay. First thing is like when যখন আমাদের কেউ শুনি থাইরয়েড হয়েছে, কিরে তো থাইরয়েড হয়েছে, সয়াবিন খাবি না কিন্তু, বা এই জিনিস খাবি না, ওই জিনিস খাবি না, মানে কোন টাইপ অফ থাইরয়েড হয়েছে সেটা কিন্তু আমরা জানি না। তো এইগুলোই হচ্ছে তো এক একটা মিস কনসেপ্ট অর এনিথিং আমরা যেটা বলতে পারি। সো দ্য নেক্সট থিং ইজ যে থাইরয়েড ইস্যুস আর রিয়াল অর ইট ইজ পার্টিকুলারলি ফর ফিমেল। Thyroid is only for female thyroid diseases. That's not true. Okay. One thing is that I am gaining weight. That's mean I am a thyroid patient. That's not always the truth. And also, if I am detecting with hypothyroidism or hyperthyroidism, I have to quit all the God-present foods. Now, we can do the moderation. We can change the cooking method also. So, also one thing is like I'm taking the thyroid medication. Why my TSS level, T4, T3 level is not lowering? It is the same. My medication is not working. That's not the truth. It needs time. Okay, so we will go through the next slide. Okay, next, optimizing thyroid medication intake. Okay, uh, first of all, we all say that how can we take the medicine or what type of medicine we will take. First thing is we will take levothyroxine. Okay, levothyroxine we will take T4 or thyroxine like form in our medication form. Okay, so we cannot take this medicine with coffee. Why not coffee? As we all know that thyroid medicine we will take in the early morning. So our habit is we will fresh up, take the medicine and eating the coffee or chai. So if someone is the patient of thyroid patient, then we have to tell them not to consume the coffee after the medication. We need to give a 1 hour of gap. Why? Because coffee can interact with this medication and inhibits its function. Same as the calcium, iron, fiber. These all are the things like they can helpful, but they are not in like medication with the levothyroxine group medication. They all can attach, they all can interfere. So the function of the levothyroxine is hampered. Its efficacy is decreases. So after taking, we will suggest our patient that before going to the bed, just in the morning, just take the medicine and then do freshen up, do the household work. Then after 1 year, oh, sorry, 1 hour, we can take our foods, we can take our breakfast and all. Okay. Okay, and also the papaya. We can also, for some reason, if we are hypo and like we are gaining weight, so we need to many or things like we don't eat carbs and all. We are starting our day with fruits like papaya. It's more fiber and all. It's okay, but the thing is like not after the medication. We need to get this done. Why? It's also that the papaya have Pepsi and it also get hampered with the medication and it also delay or uh, lower the efficacy of the medicine. So next slide. So in the next slide, we will just go through that. Timing is the key, like empty stomach in the morning and should be eaten only with plain water. No juice, no coffee, no tea, as they all cannot do the, if we are taking medicine with these items, the medicine will not be absorbed by our body fully and it will not do its work. Okay, wait before eating. Consistency is the matter. Okay, we need to take the medicine in proper time, and in the same time we will try to do that. Okay, and obviously avoid interaction. Like we will not take iron supplementation or calcium or any supplementation with our thyroxine or thyroid medication. Okay. Now we will move to the medical nutrition therapy for thyroid patient. What to eat, what not to eat, and why to eat. Okay. The next is the role of protein in managing thyroid disorders. Okay. Am I audible now?
Yes,
Yes,
yes.
Vidisha, you are audible.
Okay. 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 Okay.
Yes, you are.
Or why we need protein? Why we need protein? Like for thyroxine formation, we need amino acid. Which amino acid? That is thyroxine. Okay. So if in our body there is less amount of protein, or our dietary habit or our daily plate is not these types of protein, so what happens? There will be less tyrosine. And there, if there is a less tyrosine, how the hormone will be produced? So if the hormone will be not produced, then thyroxine also not be produced. That's the main thing. Like thyroglobulin, this molecule will not form. And if the thyroglobulin is not molecule is not there or will not form, then how the hormone will be you know produced? So and the next one main thing is like TBG. We are in our week 3, all are talking about 3BG in our slide, mainly thyroxine binding globulin or TBG. Will decide like how much free T3 and T4 will be in our body. So if there is, that's why also we need to good quality of protein that helps to give the if the TBG is high, then the free T3 and T4 will be decreases. So we need to take this as a whole. Okay. Next, okay. Protein is also helps to build the building muscle. Okay. For hypothyroidism patient, what happened? Their metabolism is already very slow. So for the energy, many times for the energy will come from our muscle protein, and that is not normal, and that is our and we are scared for muscle protein losing. So for hypothyroidism patient, muscle maintaining is very important. So in that case we have to depend on protein. So now we'll talk about that the sources of protein, which types of protein we can take. The first thing we can say, the which type of protein we can take is lean protein. Lean protein, that is we can chicken, fish. Okay. And the one thing is like egg. Okay. Egg have protein sources. It has a good source of selenium, and it also good source of iodine. And we all know that eggs is rich in iodine and selenium, and for activation of iodine it also needs selenium. So egg egg say, but egg is a good source of protein. Not only protein, iodine, selenium also. Okay. Okay, and other things we can also take legumes. Why legumes? Legumes is not only a good source of protein. We all know that it contains fiber. So how fiber can help us in that case? For metabolism, like they also have fiber. Many times we see that for metabolism, hypothyroid patient facing a constipation. For them also, legumes can will be helpful. Okay, from next slide, Bidisha Acharji will explain the role of micronutrients, and over to you, Bidisha.
At first, I want to say thank you so much, sir, for giving me this, giving us this opportunity, and thank you for this nice introduction. So, as my co-speaker previously mentioned that about the role of protein in managing the thyroid disorder. So now we will discuss the role of micronutrients in managing the thyroid disorders. So the first micronutrient is iodine. So Basically, iodine is essential for the synthesis of the thyroid hormones, and the sources are it basically found in the dairy and iodized salt. And the next one is selenium. It mainly very much necessary for the conversion of T4 to active T3, and it also act as an antioxidant protecting the thyroid gland. And the sources are basically nuts, seafood, sunflower seeds. The third one is zinc. It basically involved in the TSH production and the conversion, also in conversion of T4 to T3. It basically found in red meat, poultry, beans, and nuts. Next one is vitamin D. It plays a immune modulation and may be linked to autoimmune thyroid conditions. It basically we get the vitamin D from the sunlight, and also we get some kind of like from the fatty fish and the fortified foods. The next one is vitamin B, especially the vitamin B12. It important for the energy metabolism. Deficiencies are common in the thyroid patients. They feel the fatigue and they have the lack of energy, so they faces the deficiency of the basically especially the vitamin B12, and it basically found in the and fortified cereals. So in the thyroid patients, we should give the food those micronutrients. So and we also give the supplementation to the patients. Yes, with under the guidance of the health professions, health and the dietitians. Next slide. Here we discuss about the goitrogens and the GFC diet. At first, I want to say about if anyone say would like to say that the full form of the GFC diet. Hello.
Gluten-free,
Gluten-free
casein-free.
Okay. Thank you so much. So here we discuss about the goitrogens. So the thyroid gland uses iodine to produce the thyroid hormones, basically the T4, which regulate the metabolism, growth, and development. Goitrogens interfere with this process mainly in two ways. One, inhibition of the iodine uptake. In this, some goitrogen block the sodium iodide symporters, reducing the amount of the iodine that enters the thyroid gland. And the less iodine means less production of hormones. And the second one, disruption of the hormonal synthesis. In this, other goitrogens inhibit the thyroid peroxides, TPO, an enzyme. It's an enzyme necessary for the synthesis of the T3 and T4. This result in reduced thyroid hormone levels. As a result, the pituitary gland releases more thyroid stimulating hormone to compensate, which may lead to an enlarged thyroid known as goiters. So there are some goitrogen rich foods like broccoli, cauliflower, strawberry, red wine, soy products, peaches, peanuts, teas, and mustards. Okay, next slide. So now, here we elaborate the GFCF diet. So, it's basically a gluten-free, casein-free diet. It's help people with autoimmune thyroid disorder like Hashimoto's by reducing the inflammation and lowering the thyroid antibodies. It improves the gut health also because maximum gluten and casein uh, just do the inflammation in our gut, and most of the people without like I am not a lactose intolerance, but I can't tolerate the casein. So it causes the inflammation in most of. So uh, this diet help in reduction of the inflammation. Removing gluten is especially helpful for those with celiac disease or gluten sensitivity. Avoiding dairy like caseins can reduce the digestive issue and improve thyroid medication absorption. However, it must be balanced to avoid nutrient deficiencies. Next slide, please. So, there is a list those foods should be avoided in these thyroid disorders. So the foods are at first the cruciferous vegetables, as it's the it causes um, negative impact to the thyroid patients. So the cruciferous vegetables should be avoided. Basically, those are sulfur containing, and we also avoid the um, soya products, carbonated soft drinks, caffeine, fast food, and the bakery products. These are uh, these are not uh, allowed for the thyroid. Maybe for we can try these, but these foods should be restricted. And we also like thiocyanate content nitrogenous foods like the um, millets. These also be restricted in this, and those foods should be allowed in this disorder, like nuts. It's rich in the micronutrients. Walnuts, almonds, like this, and the lemon, honey can give more vegetables we can give, and also the lean protein and eggs. It's also the resource acid and the another micronutrient, so we can give this, and also we give the probiotic rich foods. Next slide. So there are some lifestyle management and dietary protocols which help in the maintain the thyroid health. First one is balanced nutrition, emphasizing whole unprocessed foods, and incorporate the lean protein, healthy fat, and a wide variety of fruits and vegetables to adequate micronutrient intake and support overall metabolic health is very much necessary. Second one is regular exercise. Exercise help manage weight, improve mood, and boost the energy level and supports cardiovascular health. All these are very much beneficial patients. Third one is stress management. Now, in this era, everyone is stressed, depressed. So, the chronic stress can negatively impact the endocrine system, include the thyroid. Practice like medication, yoga, mindfulness, deep breathing, exercise, spending time with the nature help in reducing the stress level that should be helpful in the management of the thyroid disorders. And the number four is adequate. Prioritize 7 to 9 hours of quality sleep per night is very much necessary. Sleep deprivation can disrupt the hormonal balance as and exacerbate the symptoms of the thyroid dysfunction, such as fatigue, difficulty in concentration. Next slide, please. So, as we come to the close of this presentation, let's remember that a thyroid may be small, but it plays a huge role in our overall health, from metabolism to mood to energy, and the heart function. Awareness is the first step toward early detection and treatment. So, whether it's fatigue, weight changes, or mood swing, don't ignore the sign. Together, we can build a future where thyroid health is understood, diagnosed early, and managed well. So, let us continue to educate, support those affected by thyroid disorder. Let's stay committed to spreading awareness not just for today but for every day. Thank you. Thank you so much for your kind attention.
Thank you so much, everyone. So we have to remember that globally more than 200 million people are estimated to be dealing with thyroid disorder, and which 50% of these cases remain undiagnosed. So we have to very carefully follow the rules and regulation to the diagnosis and for the awareness and prevention of thyroid health, for the better health and management of our lifestyle.
কারোর কোনো কোয়েশ্চেন আছে বা কিছু শেয়ার করার আছে তো জিজ্ঞাসা করতে পারো। কারোর যদি কোনো কোয়েরি থাকে আমাদের স্পিকারদের তোমরা জিজ্ঞাসা করতে পারো।
Any question যাদের কোনো myths আছে বা any feedback you want to share? I saw 70, more than 70 people were there, but it was so crisp, Vidisha. I really want to appreciate all of you. But it was so crisp from the Shubhangi's part to each and every. All four of you has done a very good job, especially Vidisha's that medicinal part. Most of the patient, as a dietitian, even we every day forgot that without any juice, without any milk, without any tea, অনেক পেশেন্টকে আমি দেখেছি চায়ের সাথে থাইরয়েডের ওষুধটা খাচ্ছে। So even our endocrinologist never aware them about the thing it is which is important. Another very myths, already I got a phone call in between, so I think Shubhangi তোমরা এটা বোধহয় ডিসকাস করেছো about that goiterogenic substance and boiling it, and এটা একেবারেই খাওয়া যাবে না। This is not that fact that we cannot eat totally goiterogenic substance, we have to totally stop. But problem is, Vidisha, we do not take each and everyday soya products. We are not taking soya products in kg, right? So this is a very important thing. Even for the renal patient, Vidisha, we do not restrict so much of each and everything unless and until there is too high potassium or too high sodium. If we eliminate it, give a big list, they will be more confused, they will end up with malnutrition.
As sir, আমরা cooking, we can change the cooking method. Cooking method is the one thing that method and how can we prepare the food.
Give some
That's
examples.
the thing. Sir, I'm talking about the soya products now. Okay, sir. I'm a soybean lover. If any day I'm detecting with any types of hypothyroidism or hyper, the first thing is like if the level is too high, then I have to control it. If there is a moderation, then I can do the cooking method procedure. How can, first of all, we can soak the soybean in a warm water.
Paddoja ma'am has
it.
joined. Paddoja ma'am has given a very good feedback. Vidisha, your part was great. So thank you, Paddoja ma'am, for joining the session. Thank you. This is inspiration when the senior dietitians used to join and give us the feedback. Actually, there was some problem in the link, so I have shared the link very later, but still Paddoja time kore join koreche. It was a great thing that you have given a time. Yes, Vidisha, you continue.
Okay, sir. So that cooking procedure, then we can warm the soybean, then wash it, and then make it. And small portion we can. So same as any renal patient or anything, for our diet paternity or for our dietitian, moderation is our word. Moderation is our
the key.
Doctors
two
have
word.
been
I agree with you. 2 word: moderation and modification, rather than too much of restriction and calculation. moderation and modification. If you do, you can change the life of the patients. And obviously, in cognized nutrition, we always promote the scientific knowledge and upgradation of the current guideline. If you are not aware of the biochemistry of the thing, so you cannot fight with the doctor. Suppose a village physician doctor or a very old school doctor totally have restricted this list that you are a soybean lover, but never you can have soybean. So these are literally pathetic for the patient to do that. I have to totally, even for especially thyroid থেকে বেশি হয় uric acid. It is a very big list when we have to stop each and everything in hyperuricemia. But if we maintain this, actually the science is not changing. Evolutionary things are changing, that people are, scientific data, they are understanding that this was previously cannot be কি করে হলো একটা টাইমে এই গিয়ক খারাপ ছিল আজকে কি করে সায়েন্স চেঞ্জ হয়ে এই গিয়ক ভালো হয়ে গেল and we can give a giyok to each and every patients of cardiac patients. How it changes, because it is not that previously we know everything wrong and everything which is now we are telling everything right, but the biochemistry or the what is happening inside the body is more important. That dietary cholesterol does not have so much impact on your blood cholesterol or serum cholesterol. Those who is sharing the screen, Paramita can stop the sharing of the screen. Any more questions from the audience or the students? Any doubt? Because those who have already joined our classes by the eminent speaker on thyroid, so their doubts are totally clear. Still, it is a overall 1 hour brush up type of thing, and we just updated you about what is good or what is bad. So this all, thank you Chandrani and everybody who have given feedbacks in the chat box, and other people also. Thank you so much. So if we do not have any questions, so Paramita, we can wind up the session for now. So thank you everyone.